Hi everyone. Today I am going to discuss about National Leprosy Eradication Program. I am Sasi, working as a assistant professor in Tribulum College of Nursing. Objectives: the student is able to understand the milestones of National Leprosy Eradication Program, narrate the strategy of National Leprosy Eradication Program, explain the initiatives of National Leprosy Eradication Program, enlist the program implementation plan in National Leprosy Eradication Program. Let me see one by one. Introduction. Leprosy, also known as Hansen disease, is a chronic infectious disease caused by Mycobacterium leprae. The clinical features of the leprosy is hypopigmented patch, loss of cutaneous sensation, thickened nerve. Based on number of skin lesions and nerves involved, it was divided into two types. One is passibacillary leprosy and multibacillary leprosy. In passibacillary leprosy, where the skin lesion will be less than 5. In multibacillary leprosy, the skin lesion will be more than 5. The National Leprosy Eradication Program is a centrally sponsored health scheme under the National Health Mission of the Ministry of Health and Family Welfare, Government of India. The program is headed by the Deputy Director of Health Services, Leprosy under the administrative control of the Director General of Health Services, Government of India. While the National Leprosy Eradication Program strategies and plans are formulated centrally, the program is implemented by the states or union territories. Milestones. In the year of 1955, National Leprosy Control Program was initiated. In 1982, introduction of multi-drug treatment under National Program. 1983, National Leprosy Eradication Program. 1991, World Health Assembly resolved to eliminate leprosy at a global level by the year 2000. 1993 to 2000, the first phase of the World Bank supported National Leprosy Elimination Project was initiated. 2001 to 2004, the second phase of the World Bank supported National Leprosy Elimination Project was initiated. 2005, India achieved elimination of leprosy as a public health program at national level. Coming to the strategy, that is leprosy elimination in India. Decentralized integrated leprosy service through general healthcare system, early detection and complete treatment of new leprosy cases, carrying out household contact survey in detection of multibacillary and child cases, early diagnosis and prompt multi-drug treatment through routine and special efforts, involvement of accredited social health activists in the detection and complete treatment of leprosy cases, strengthening of disability prevention and medical rehabilitation services, information, education, communication activities in the community to improve self-reporting to primary health center and reduction of stigma, intensive monitoring and supervision. The major initiatives: more focus given to new cases detection than prevalence. Treatment completion rate is taken as an important indicator. More emphasis is being given on providing disability prevention and medical rehabilitation services to leprosy affected persons. Dressing materials, supportive medicines and ulcer kits to affected person with ulcers and wounds. Microcellular rubber footwear for provided for protection of insensitivity feet. NGOs and medical colleges strengthened for providing reconstructive surgeries. Incentives of rupees 5,000 for below poverty line patient who undergo surgery to compensate loss of wages. Support to government institution and PMR centers in the form of for rupees 5,000 for reconstructive surgery conducted. Major initiatives: ASHA workers who is working in the village level, if she is bringing confirmed diagnosis of case brought by them, rupees 200 will be awarded to ASHA workers. One completion of full course treatment rupees 400 for bacillary leprosy and 600 for multibacillary leprosy. An early case before onset of any visible deformity, rupees 200 rupees will be awarded to ASHA worker. A new case with a visible deformity in hands, feet or eyes, rupees 200 rupees will be given to ASHA worker. And free medical facilities in patients residing in self-settled colonies. An intensive IEC campaign with a theme towards leprosy-free India. Disability prevention and medical rehabilitation. Implementation of disability prevention and medical rehabilitation activities are as per guidelines, reporting its outcome. Second one is integrating DBMR services to develop referral system to provide prevention of disability services to all leprosy disabled person. Service in the urban areas. For the implementation of special action under the plan, about 524 urban localities have been identified out of 4,388 urban areas. These localities are having population more than 1 lakh. Referral system. The sub-center, the implementation will be self-care advice, advice to reconstitute cases and monitoring. Then these are the referral will be done. These are all the patient who is having reaction and disability. They will be referred to the primary health centers. Primary health centers, the implementations will be manage the reaction if possible or refer. Identify or refer patient needing reconstructive surgeries. Identify the patient needing footwear. Advice to reconstructive surgery cases, advice to self-care. In lepra reaction difficult to manage, complicated ulcer, eye problems, reconstructive surgery cases, persons needing footwear, follow-up of reconstructive surgeries, lepra reaction, these cases they will be referring to the district hospitals. Coming to the district hospitals, the implementations will be management of complicated ulcers, management of lepra reactions, and refer difficult ulcer cases to reconstructive surgery centers will be done by the district hospitals. From the district hospital, they will go to the district nucleus area, where the implementation will be management of lepra reactions, supply of footwear, and they will be referred during when they need reconstructive surgeries and follow up reconstructive surgeries. They will go to the reconstructive surgery centers. In the reconstructive surgery centers, the implementation will be reconstructive surgery, follow up after reconstructive surgery, supply of footwear to district nucleus hospitals. Coming to the program implementation plan for 12th plan period, the objectives. First one is elimination of leprosy, prevalence of less than 1 case per 10,000 population in all districts of the country. Strengthen disability prevention and medical rehabilitation of persons affected by leprosy. Reduction in the level of stigma associated with leprosy. Program strategies. In integrated leprosy service through general healthcare system, early detection and complete treatment of new leprosy cases, carrying out household contact survey for early detection of cases, involvement of aggregated social health activities in the detection and completion of treatment of leprosy cases on time, strengthening of disability prevention, medical rehabilitation services, information, education and communication activities in the community to improve self-reporting to primary health centers and reduction of stigma, intensive monitoring and supervision. Coming to the waste reduction and management, to improve access to services, to involve women including leprosy affected person in case detection, to organize skin camps for detecting leprosy patients while providing services for other skin conditions, to undertake contact survey to identify the sources in the neighborhood of each child or MP cases, to increase awareness through the ANM, Anganwadi workers, Ashas and other health workers visiting the villages, people affected by leprosy, to suspect and motivate leprosy affected persons for early reporting to the medical officer. Services in urban areas, identify the human resource available with the government, civil societies, non-governmental organization and private medical practitioners for leprosy services like suspect and referral. Build the capacity of the identified human resources at the time of induction and periodically. Examination of all household contacts of all new cases at least once before the completion of treatment of index cases. Identify one referral centers in each urban location for diagnosis and to manage the leprosy with or without complications. Supervision and monitoring of the program is the responsibility of the district leprosy officer and medical officer of the referral center. Mobile health clinics of general health services, including leprosy services on their visit to slums, urban villages. Develop a system of record keeping and reporting by each participating center. Develop a system of regular multi-drug treatment supply to each health center. Procure additional requirement of drugs, dressing materials, aids and appliances for inhabitants of leprosy colony requiring regular care for their disabilities. Organize sensitization meeting for IEC and advocacy. Participate in exhibition, quiz competition for awareness to reduce stigma. Information, education and communication. To develop communication material, vice versa, the target audience and delivery effectively. To complement and support the detection and treatment services being provided free of cost through the general healthcare system. To remove stigma associated with leprosy and prevent discrimination against leprosy affected persons. National Leprosy Eradication Agencies. The first one is Leprosy Mission, Damien Foundation of India Trust, Netherlands Leprosy Relief, German Leprosy Relief Association, Lepra India, ALES Swiss Leprosy Relief Association, AFO, Italian Leprosy Relief Association, Fontaines India, AFRF India, French Leprosy Relief Association, American Leprosy Foundation. WHO has announced Global Leprosy Strategies 2016 to 2020, accelerating towards a leprosy-free world for further reducing the disease burden due to leprosy. Conclusion. The National Leprosy Elimination Program had a favorable impact, but at the same time, to reach the elimination status, there was a need for more stringent information, education and communication activities to be promoted in the community. Active surveillance should be initiated so that hidden cases are not missed in the community. Reference www.nationalleprosyeradication.com. Thank you for watching my video.